Welcome to Alpha Recap, your quick, clear wrap of the day's biggest market moves. We're coming to you after the close with two headlines that, oddly enough, shared the same theme: acceleration. As always, if you have questions, you can reach us at stockalpha.ai.
Hey, great to be here. Two very different sectors, cloud infrastructure and cancer therapies, both racing to compress time from idea to impact. Love it.
Right, and let's jump in. First up, OpsGuru, an Amazon Web Services premier tier services partner, announced an energy Lakehouse accelerator. The headline, and this is the headline, is a claimed reduction in AI data infrastructure build times by up to 80%.
80%. That's the number that made everybody sit up. They said projects that used to take 6 to 12 months can now be done in weeks. Big claim.
So, what really stands out here is the idea of a verticalized lakehouse. Quick recap for listeners who aren't data nerds. A lakehouse blends the cheap, flexible storage of a data lake with the structured query and governance you expect from a data warehouse. It's attempting to solve the messy problem of siloed, chaotic enterprise data.
And the energy vertical is a tough one. Tons of time series telemetry, geospatial stuff, sensors, commodity data. If you can bake in domain-specific ingestion and transformation logic, that's a lot of repeated work avoided.
I mean, when you step back and look at this, the promise is less about magic and more about pre-built plumbing. If OpsGuru has robust templates for energy data flows and governance, teams could shave months off the plumbing stage and get to models and analytics faster.
Right. And the other thing is, it's partner-driven. AWS needs partners who can deliver vertical solutions. That increases stickiness. But of course, skeptics will ask, what's the real cost?
Exactly. Proponents point to faster time to value. Skeptics point to vendor lock-in, hidden migration costs, and ongoing cloud bills if the architecture isn't optimized. An 80% faster build time is a great marketing stat, but total cost of ownership, or TCO, still matters.
Yeah, that tracks.
Okay, shifting gears. Big clinical headline today. Jiahui International Cancer Center announced access for patients worldwide to Satri-cel, also known as CT-041, or Kai-Mei, which was celebrated as the world's first CAR-T therapy approved for a solid tumor. That's huge.
This is the one that really tightens the focus on execution. CAR-T, quick primer, reprograms a patient's T-cells to target a specific antigen on cancer cells. It's been transformative in blood cancers, but solid tumors present extra hurdles: antigen variability, the tumor microenvironment, and delivery challenges.
So, what really stands out here is the regulatory milestone. Approval signals a technical and clinical advance, but it immediately forces the question: how do you actually get this therapy to patients at scale? Manufacturing, cold chain logistics, center accreditation, those are massive operational questions.
And then there's the commercial side: payers, reimbursement, and whether other regulators follow suit. Approval is one thing. Broad, durable access is another.
I was a bit surprised by how quickly the press framed this as worldwide access via Jiahui centers. That could mean faster access in some regions, but it also raises equity questions. Who gets treated first? Where are the manufacturing hubs located? How will smaller countries be served?
Short reactions.
Big move.
Not what anyone expected years ago.
Let's synthesize the shared theme: acceleration. On one side, an accelerator that promises to cut AI build time from months to weeks. On the other, a therapy that compresses decades of oncology progress into a regulatory milestone. Both are about speed, but speed shifts the locus of risk to execution.
Analysts broadly agreed these were positive innovation signals today. But they split when it came to the follow-through. For the OpsGuru announcement, Watch for customer adoption metrics, signed engagements, real time-to-production numbers, and whether those proofs actually translate into enterprise deployments.
For Satri-cel, analysts will be watching early real-world outcomes, manufacturing scale-up announcements, third-party contract manufacturing organization partnerships, and payer decisions in big markets. Those operational moves will determine whether the approval turns into sustained commercial success.
And different investors will read these headlines differently. Institutional, long-horizon investors might see this as a sign that cloud platform adoption is deepening, with partners like OpsGuru expanding addressable services and stickiness for AWS. In healthcare, long-horizon players will note a new regulatory door opening for solid-tumor cell therapies.
Growth and momentum investors probably cheered the initial sentiment today, while event-driven traders will be looking for specific catalysts. Partner case studies, pricing and packaging for the Lakehouse, and reimbursement and early sales data for Satri-cel.
Speculative traders will want to see follow-up details quickly. Does OpsGuru publish live customer stories showing that 6 to 12-month projects actually move to production in weeks? Does Jiahui publish real-world registries showing durable responses outside trial settings?
A few practical watch items for both stories. For the Lakehouse, number of signed engagements, realized time to production in live cases, integration with operational technology systems, and audit security certifications that meet energy sector rules.
For the CAR-T, real-world efficacy and safety reports, announcements about manufacturing capacity, partnerships with CMOs, and payer coverage decisions. Those are the dominoes that follow regulatory approval.
Right. And the other thing is the question of pricing models for the tech side. Is OpsGuru selling this as professional services, managed services, or a packaged subscription? That changes partner economics and enterprise budgeting.
I mean, when you step back and look at this, the strategic lesson is simple. Time to value matters, but so does time to cost. Faster doesn't automatically equal better if downstream costs and governance are uncontrolled.
Exactly. Partnerships also matter. Accelerators increase the importance of systems integrators and specialized partners. Buyers should map vendor dependencies and quantify lock-in risks before committing critical infrastructure to a single partner.
And in biotech, the risk profile flips from clinical trial outcomes to commercial execution. Approval shifts scrutiny to manufacturing scale, distribution, pricing, and the ability to generate broad, real-world evidence.
A few caveats we should repeat for listeners. This is market analysis for informational purposes only. We're not giving personalized investment advice or telling anyone to buy, sell, or hold any stock. Analysts note potential upside, but a lot depends on follow-through.
Short reactions.
Due diligence required.
Watch the execution, not just the headlines.
Quick recap of key takeaways. 1. Time compression is the common narrative. Both announcements are about getting from innovation to delivery faster. 2. Execution risk concentrates after acceleration. Integration, governance, and cloud economics on the tech side, manufacturing, distribution, and reimbursement on the biotech side. 3. The market will be watching concrete metrics, adoption and case studies for OpsGuru, and real-world outcomes and manufacturing scale for Satri-cel.
And lastly, keep an eye on partner dynamics. Platform providers stand to benefit if accelerators drive stickiness, but buyers need to evaluate lock-in and long-run costs. For the CAR-T, regulators have opened a door. Now the industry needs to build the hallway.
Okay, that's a wrap for today. If you want the links and a deeper read, everything came from the breaking announcements distributed via PR Newswire on June 24, 2026. OpsGuru with AWS and Jiahui with Satri-cel.
And if you have questions about anything we covered today, head to stockalpha.ai, where you can ask us directly and we'll answer live. For more market analysis and insights, visit stockalpha.ai.
Thanks for listening. Markets were closed when we recorded this. We're summarizing events after the day's close. And as always, this is informational only. See you next time on Alpha Recap.